1 in every 6 couples worldwide at some point in their lives experience infertility. Yet many believe that IVF is for the wealthy. Others also believe that IVF babies are different from normal babies made in the bedroom. Today on Health with Patricia, where we have honest conversations about issues affecting your health and well-being, we'll be separating the fact from the myth. We want to understand IVF. All about IVF, who can do IVF, what are some of the misconceptions that need to be ruled out? And my guest, Dr. Joseph Homiah, he's the medical director for Accra Fertility Center. Okay. Dr. Homiah, thank you very much for your time on Health with Patricia.
You're welcome.
Yes, IVF.
Yes. IVF basically means that we are fertilizing eggs outside.
Okay.
Like you mentioned earlier, 6% of couples will not be able to naturally have conception. So IVF is a kind of technology to kind of achieve conception in such couples. And the basic thing about IVF is fertilization outside, in vitro fertilization, fertilization in the lab. So we get the sperm from the man, we get the eggs from the woman, fertilize them in the lab, then we put the resulting babies back into the womb. Basically, that's what IVF is about.
At what point should couple come in, like maybe consider IVF as maybe a second option?
Yes, I mean, there are reasons where IVF should be your first option. For instance, if there's
not a second option.
Not the second option.
Okay.
There's a very poor sperm count. Some men don't produce sperm at all.
But they ejaculate.
Yes, but what comes is not sperm.
It's water.
It's seminal fluid. Might not contain sperm.
Okay,
In
sure.
very rare instances, the sperm can be picked from the testes.
Okay.
By surgical means. But that's for men who have no sperm in their ejaculates. But they have it in the scrotum. Or
so
the
you just have to go in there and then take it from there.
Take it from there and use it for the IVF process.
Okay, sure.
For such people, what you need is IVF. Some women have their tubes blocked. What they need is IVF because there's no way the sperm and the egg are going to meet to achieve conception.
Okay.
Then there's a big area called the unexplained infertility, where couples have stayed together, they've done all the investigations, there's no problem, nothing has been found to be wrong, but they are still unable to achieve conception. IVF is a way to achieve conception in such couples. So there are various reasons why.
Okay. So when you say unexplained infertility, is it that the couple they're not compatible? Would it be right for me to say that they are not compatible?
I wouldn't say they are not compatible. Such couples eventually could achieve conception.
Okay.
But, you know, a woman has a biological clock and is always ticking. So the woman hasn't got all the time forever.
Okay.
At some point, she has to make a decision. So sometimes, yes, there's a bit of incompatibility because it's been shown that when such people change couples, they tend to achieve conception.
Yeah.
But that's not promoting change of. There are ways to achieve conception.
Okay. You also mentioned tubal blockage.
Yes.
What if we blow the tubes or open it? Is that also, instead of the IVF, like you just go in for that? Is that
before the advent of IVF, tubal surgery used to be the mainstay when there's a tubal blockage. But with IVF, most doctors don't do tubal blockage. Two main reasons. After you open the tubes, there's the high likelihood that it will close again.
Oh, wow.
The second thing is that if the woman gets pregnant, there's a high likelihood that it's going to result in an ectopic pregnancy. The third thing is that tubal surgery is not easy surgery. It's very complex surgery. I mean, the skill to do it is virtually missing amongst new gynecologists.
Oh, okay.
Most gynecologists, the 60s, 70s, could do it, but not because it's not being done anymore.
Okay.
It's basically, if the tubes are blocked, IVF. Very few cases of tuboplasty, as we call it, which is done laparoscopically. We do it once in a while, but the results are not as effective as IVF.
To dwell a little on the tubal blockage, what actually causes it to block? Is it the age or what?
In Africa, mostly it's infections. infections, gonorrhea, chlamydia,
Okay.
tuberculosis, abortions, pelvic surgeries. Most these are the commonest causes of some few congenital. They are
Okay.
born with it, but mostly it's infections.
Okay.
Gonorrhea, improperly treated gonorrhea or chlamydia infection.
Improperly done abortions.
Improperly done, yes, done abortions.
Tuberculosis.
Yes. Even syphilis and all these infections. Any pelvic infection that is not properly treated. Most women get an infection, they are given antibiotics. You take it once, the pain goes the first day, then they stop it. The pain is gone, but the bacteria is still there. It's not dead yet. That is when it causes the damage. And the two key ones are gonorrhea and chlamydia. Gonorrhea, people go to the pharmacy, they get Cipro, they take it, first day the symptoms are gone, but the effects is still ongoing. Abortions, which is not done properly, no antibiotics after. The fetus is out, but a bit of the product of conception is still left there. This is the medium for bacteria to grow. And as they grow, they block the tubes. So these are the three main causes of tubal blockage.
Away from tubal blockage, the main thing is IVF.
So basically what happens is that we need to get the eggs outside and the sperm outside. To do that, the woman has to go through some injections for about 10 to 14 days every day.
That's going to be painful.
That's a bit painful, yes.
Because one injection alone
is one injection. So that's what we call the stimulation phase.
Okay.
We are stimulating you to produce a good number of eggs because a woman normally produces only one egg a month.
Okay.
But in IVF, we're looking at about 6 to 10 eggs.
Okay, sure.
To do that, we need to put you through these injections.
Whilst you're trying to boost the egg quantity, is it also helping with the quality?
Unfortunately, it doesn't help with the quality.
It's just the quantity, just for you to produce. Okay.
To produce a good number of eggs. So we'll be doing scans along the line to check how the eggs are developing.
Okay, sure.
When the eggs reach maturity, then we take you to theater to go and pick it up. It's a minor surgical process. It doesn't take even more than 20 minutes. We sedate the woman a bit. Then with a special scan, we pick the eggs through the vagina.
Okay.
It's a minor process. After 2 hours, you can get up and walk back home.
Not to cut you, I want to understand. Like when it comes to the men, you're able to determine abnormal from normal when it comes to their seed.
Yes.
Is it the same with the women too? The egg, are you able to determine that this egg is good and that egg is bad, or maybe not fully, is abnormal?
Yeah, you can predict that this patient might produce abnormal eggs because of the age. As I mentioned, the older you are, the less. Certain conditions like PCOS might not give you very quality eggs. A condition we call endometriosis might not give you quality eggs. So basically the age and certain medical conditions could tell you that these eggs might not be up to the standard that you want.
Okay, sure.
But the only time you can actually determine is when it's been picked up and you look at it under the microscope. Then you can actually determine the quality of the egg.
Okay, sure.
So once we pick the eggs, that's the day the husband also has to produce the semen sample. And this ideally has to be produced in-house by masturbation.
Okay.
Not by sexual intercourse. That is where sometimes a bit of a challenge comes because some men are unable to masturbate by themselves. But to get a very good sample, you need to masturbate. Or sometimes we can make, some might not be ready to produce in a hospital. You could produce around, maybe a facility around, but the sperm sample should be in the hospital within 30 minutes.
Oh, so it's just advisable you do it here?
It's advisable, but sometimes the pressure is too much for the men and all that. But most often, you have to produce it in-house. So once we get the eggs, we get the sperm, we give it to the embryologist. Then they have two ways of mixing it up. There's one called ICSI. When the sperm count is very poor, you take one egg, one sperm, and actually fix it inside. When the sperm count is not too poor, you just mix them. Then the next day, he will check under the microscope then you see that they're fertilized. There are features you see to show you that these eggs are fertilized or these ones that didn't fertilize.
Okay, sure.
Then you see the babies or the embryos growing in the lab. Every day you look under them, you see that they are multiplying.
Okay.
They're multiplying in the lab. But for our purpose, beyond day 5 days after the fertilization, we are unable to keep embryos. I mean, worldwide.
Okay, sure.
We don't have the capacity to keep them. Otherwise, we could grow them into babies in the lab. But at that point, the technology ends. So it has to go back to where it's supposed to be, and that's the mother's womb. Okay. So we transfer back to the mother's womb. Then she has to do some injections, what we call luteal phase support with progesterone for about 2 weeks. And that is what we call the almighty waiting period, when the anxiety is so high because you're waiting to see the results of your procedure. So after 2 weeks, you come back to the clinic, then we have a blood test. Then we know whether you're successful or not. Yes.
But don't you think this anxiety can, one way or the other, terminate the pregnancy?
Anxiety could affect, yes. It's a natural thing.
Yeah.
You know, you've gone through all these injections, paid a lot of money, and you don't know what is going to happen. That's why we encourage family support at our units. Our nurses also give you support. They'll be calling you along the line, giving you reassurance. All you can do is to relax and pray. And most often, you get a good result out of it.
When you take the semen or the sperms from the man and then the egg from the woman, how do you store it?
No, we combine it sort of.
Immediately?
Yes.
Okay.
We put it together. That's why I'm saying there are two methods. There's something we call ICSI, intracytoplasmic sperm injection. That is for those with very low sperm counts, less than 1 million.
Oh, okay.
So you take one sperm, one egg, and inject into the egg.
Okay.
For those with sperm counts that are not too bad, you just mix the sperm and the eggs in the test tube and check the next morning to see how many have fertilized.
Oh, okay. Okay.
So depending on the quality of the sperm, we either do ICSI or normal insemination. Then the next day we check and see how many have fertilized. Because if you do 10 eggs, not all are going to fertilize. Okay. Maybe about 7 are going to fertilize. The next day you see them multiplying, dividing into like cells, human beings. But the technology has not gone beyond storing them for 5 days.
Okay.
So after 5 days, either we transfer back into the woman or we do what we call cryopreservation.
Okay.
We store it for future use. It can be stored for 5 years, 10 years. Anytime you want it, you can come back for it.
Okay.
And that is where egg storage comes in. Because now most women are not starting families early. Mm-hmm. By the time you finish university, you're almost 26, 27.
Yeah, you need to look
She's
for a job.
She's now looking for a job.
Yeah.
She wants to do her master's.
Yes.
She wants to climb the corporate ladder.
Yes.
The man is not available yet. By the time she's ready, she's about 38, 39, 40, where the egg quality and quantity has gone so low. For these women, there's an option to store your eggs at an early age.
Okay.
So you can have your eggs stored at our facility here or many other places, so that anytime if you decide to have babies around 40, your eggs will be, let's say, 20 years or 25 years instead of 40. So there will be more quality and you tend to have more success with it in an IVF process.
Okay.
Otherwise, if you don't store these eggs and you want to start at 40, 41, 42, you might need to use some of these eggs. That is what we call egg donation, which is not the first option for anybody.
People say IVF babies are different from normally conceived babies. How true is that?
There's no truth in that. The first IVF baby was born 1978.
Okay.
She's 42 years, had her babies. Since that time, almost 8 million babies have been born through IVF.
Okay.
Worldwide.
Oh, that's nice.
Yes. And all the studies have shown that they are no different from babies that are made in the bedroom.
Sure. And people also believe that IVF babies, especially because you have to take the seed and then the egg and join together, automatically you end up getting twins.
No.
Like, so it's more or less like creating the kind of babies you want.
Yeah, I mean, there's a bit of it, but that's not why you get twins. The idea is that after you fertilize the embryos, the eggs, and they start growing in the lab, when you're going to transfer, most IVF centers might transfer 1 or 2 babies. So if you transfer 2 babies and they all implant, it's twins.
Okay.
So it's not like just because of the IVF, but you are actually putting 2 babies back into the mother.
Okay, sure.
Yes.
Sure.
So that's why the twin gestation level is high.
So what happens if the first IVF fails?
Well, that's every mother's fear or every couple's fear. But
it's a
that is
normal
a reality of life, because with all the technology in IVF, we haven't gone beyond 70, 80% worldwide. I mean, you can do whatever. We haven't gone beyond that. But if it fails, that's not the end of life. It's not the end of the process.
So try again. How many times can you try?
You can try as much as possible.
Okay,
but of course, it's got financial implications, emotional and psychological implications. So sometimes at some point, but if the mother is ready to try, you can try IVF as many as you want. There's no limit to the number of times you can have an IVF process done. And the more you try, the more the chances of success.
Okay,
because,
sure.
Yes, the chance of success accumulates with every attempt that you do, because the doctor gets to know your body more. He gets to know how the embryos are more, how you respond, how the implantation occurs. So for every cycle, we learn something new about you, and most often, after the process, you might have more than 4 or 5 embryos or babies.
You can always try again.
So we can only transfer maybe 1 or 2. The rest can be stored. Like we keep it up in an incubator.
Okay.
If you have to try again, you don't go through the whole process again.
Because your eggs are already frozen.
The embryos.
Okay.
The embryos that are frozen.
Okay.
We just pass them on to you, and that's it. So it's not like every time you're going to try, you're going to go through all the injections, and every time you're going to try, you're going to pay the same amount of money. It doesn't work like that.
Talk of money. How expensive is IVF? Accra Fertility Center.
IVF, I mean, babies are supposed to be made in the bedroom.
Yes.
So even if it was 1,000 cities, obviously it's more expensive than. IVF is very high technology.
Okay.
To keep a human being growing in the test tube demands a lot of technology. And that comes with cost. And the medications that we use for the patient, I mean, having injections for almost 14 days, it all comes with cost. But on average, you're looking at about 70 to 90,000 Ghana cedis.
Yeah.
Try to make
it's worth it.
Yeah,
because at the end of the day, you still get your baby. It's worth it.
Because to see a couple go through an IVF process and go empty-handed is very devastating. So our rates are very competitive. If you compare our rates and our success rates are very competitive too. So
what are some of the factors? Yeah, he said it. This is the place to be. What are some of the factors that determines the success of an IVF?
There are a lot of factors. First, the quality of the sperm.
Okay.
There's a saying, you can force the horse to the river, but you can't force the horse to drink the from it.
So even if the man masturbates?
No, not that, but even if you get sperm and you force it into the egg, it will fertilize all right.
Oh, okay.
But the defect that was in the sperm that was preventing it from fertilizing in natural conception could still be there. So that defect might reflect in a miscarriage or failure of implantation. The egg quality. So first, the quality of the sperm.
Okay.
The egg quality. Like I mentioned, the older you are, the less the quality.
Not to cut you short, we're looking at the sperm quality and then the egg quality.
Yes.
So when they come, do you test for the quality of both? And then maybe put them on medication to help them, kind of treat them before you take...
Yes, but the point is that sometimes you can't reverse all these defects or abnormalities. So IVF is like kind of a shortcut to try and avoid these defects.
Okay.
But some of it is still there. So the success depends on the quality of the sperm, the quality of the egg, the quality of the womb.
Yeah,
sometimes
that's another thing.
Things like fibroids, things we call adenomyosis, polyps, women who've had recurrent abortions, who have infections in the womb. All these things determine whether the embryo will implant or not. Then a few things like the hormonal balance of the woman, she PCOS, is she diabetic, all those factors, and a bit of stress, lifestyle too, all affect the implantation rate.
It's a lot for the woman.
It is.
What do you, okay, so would you also encourage that maybe if the person has fibroids or polyps, you remove all of those ones, wait for the person to recover, then try?
Yes,
infection, we'll treat the infection and try.
Yes, but you have to take it one by one. It's not every fibroid that has to be removed before an IVF procedure.
Oh, okay, sure.
It's the fibroids that are in the cavity of the womb and is more than 4 centimeters in size.
Okay.
Those ones have to be removed.
Okay.
But fibroids outside the womb, you don't need to remove them.
Okay.
Obviously, before you undergo the process, we test you for infections and treat you before
you start.
Yes.
Okay.
But you can't treat the quality of an egg or a sperm.
Okay. What of the polyps?
Polyps has to be removed
okay.
before the procedure is done. Yes. So as much as possible, we have to prepare the woman appropriately. Anything that can reduce the success has to be removed.
Okay.
Sometimes we have something called hydrosalpinx. When there's fluid in the tubes, when the tubes are blocked, it accumulates fluid. You would have to remove these tubes before she undergoes an IVF procedure. So we have to take out all these stuff before she starts the process itself.
Okay.
All to increase the success rate.
Okay.
Yeah.
There's this belief that people who are overweight cannot have IVF. How true is that?
Yes, I mean, pregnancy needs a healthy body.
Okay. But some people are overweight, but so far as you're overweight, you're not healthy?
Yes, but obesity in pregnancy comes with its own complications.
Oh, okay, okay.
There's a higher risk of miscarriages, higher risk of implantation failures, higher risk of diabetes, higher risk of hypertension. So before you get pregnant, most physicians will ask you to lose weight. So for IVF, it's the same purpose. The baby has to live in a healthy body.
Baby has to live in a healthy body.
There's no point getting pregnant and having a miscarriage.
Yeah.
Or getting blood pressure to the extent that the pregnancy has to be terminated.
Okay.
You know.
So now let's look at the age. Maybe someone is 40, somebody is 45, somebody is 50, and they want to try.
Yeah. So there's a test to check your egg levels.
Okay.
It's called AMH. Anybody can do it. It's just a blood test. You draw the sample within 2 hours. The results comes. And that tells you whether you have eggs to undergo the procedure or not.
Okay.
Like I mentioned earlier, women don't have eggs forever.
Yeah.
At some point, their egg levels goes to 0. And that's normally in the 40s. And the test will tell us that your egg levels have gone far too low to be used. In which case, egg donation is a possibility or another option.
Okay.
So somebody donates her eggs and you add your husband's sperm and you carry the baby.
At that age, the womb is still firm enough or healthy enough to still carry the baby.
Even at 80 years, the womb can carry a baby.
Oh, okay, sure.
So the womb is the least of our problems. It's the egg that is a limiting factor.
Okay.
If I find an embryo and deposit it in your grandmother's womb, she'll probably get pregnant. So that's the reality. The womb is not a limiting factor in IVF.
Okay.
It's the egg. Once the womb is all right, even if the woman is 70, 80, that is where the ethical issues come in. People making 70-year-olds or 80-year-olds pregnant.
Yeah.
Is it ethical? You know? So the womb is not a factor at all. Once you have a womb,
you can carry a baby.
Yes.
Or the most important thing is the
egg.
which is was more or less like the engine.
Yes.
Yes. What are some of the misconceptions when it comes to IVF that has to be ruled out today?
Yeah, you mentioned the first one, like the babies are abnormal, which has been totally
That one is
removed.
out.
That IVF is a woman's problem. It's women who need IVF. To be frank with you, now a lot more men are responsible for IVF than women.
Because when it comes to infertility, it's not always the woman's.
No. It used to be, we used to say 30, 30, 30. 30 man, 30 woman, 30 a combination of factors, percentage. Now, when you talk to the urologists, those who look at men in terms of, it's about 50-50. In fact, if you take about 10 men and do a semen analysis, you'll be surprised that not 5 would pass the test.
Wow. So
IVF is not only for female problems, it's for male infertility too.
Okay.
Now, the other misconception is that IVF can be done at any age. Yes, it can be done at any age, but you need to be medically fit. Be medically fit to carry a pregnancy. There's a misconception that once you do IVF, you have to be in bed for 9 months. It's not true. You can do, elsewhere, people come for their embryos, sits in her car, sparks the car, go and sit in the office and work.
Okay.
So there's no where that after IVF you have to be admitted for 9 months. There's a misconception that anybody who has an IVF is going to have a CS or cesarean section. That is not true. You can have an IVF and have a normal delivery.
Okay.
There's the misconception that IVF is like Kwakwela stop. That's your end. If it doesn't happen, that's the end of you. Okay. That's not true. About 17% of women with a failed IVF will conceive naturally. Mm-hmm. And in fact, a lot of women after one IVF, successful IVF, tend to conceive naturally without any medications at all. Nobody seems to understand that. But it seems like the anxiety is gone. She's got one down already. And most women after one IVF don't show up for another IVF. They just conceive by themselves. Mm-hmm. So there's a lot of misconceptions about IVF and all that. But IVF has come to solve a very big problem. There were certain couples who naturally would never have been able to have a baby.
Okay.
But with IVF
came in,
they're able to have a family.
Okay. I want you, before your final words, right? I want you to tell the audience, those watching on all socials, all over, why they should come to Accra Fertility Center, even as we launch the IVF month.
Yes.
Let them understand that whatever help they need, we can find it at Accra Fertility Center.
Yeah.
Yes.
Accra Fertility Center is an offshoot of Medifem Hospital. Previously, when we had fertility issues, after we diagnosed them, see that they require IVF, we used to send them to South Africa, Dubai, and a few European countries. Then we decided that why should we send these patients outside? Because some of them go out and sometimes the treatment they get might not be up to what they would expect. Mm. So we set up Accra Fertility Center, and it's been almost 15 years.
Wow.
Yes, it's been 15 years, and a lot of babies have been born here.
Nice.
On Sunday, I had more than 500 Happy Father's Day from babies that had been born here. Come to Accra Fertility Center because we want to be honest with you. The couple, at this stage have been through a lot. They've seen so many doctors. They've gone through so many procedures. They need to have the honest truth. They need to understand what is happening. They need to manage their expectations. And at Accra Fertility Center, that is what we do. We walk you through the process from day one till you achieve your targets or the family that we are all looking for. It's not a one-off. We do it here, it doesn't work. That's it. We follow you up. Sometimes we call some of our clients, please come back. And July being the World IVF Month, we're going to have a promotion We're going to slash our prices down. Okay, we're calling most of our old clients. We're asking new clients to come. And we have fantastic deals to help them undergo the procedure. Don't think about the cost that you had. Come and get your own unique cost. And I'm sure most people will be able to manage it.
That's really an interesting one. I'm not sure anyone would shy away from this, because this is a juicy deal. IVF month is this July, and they're slashing down prices. So old, new clients, please come to Accra Fertility Center. I can assure you, Medifem has been my hospital for it's almost 20 years now, and I'll say they're one of the best. So please, if you really want that baby, come to Accra Fertility Center. Dr. Joseph Homiah is always available. Anytime you come, you will meet him. He's so nice and friendly. From the interview, you can even tell. So, Doc, before I wrap up finally and let you go, what is this one thing you want people to know when it comes to, like, maybe one thing, one takeaway from this interview that you want people to know?
What I want to say is that IVF is not a one jacket fits all. Everybody has what he or she needs. So just walk here and come and listen. You can interact with any of our nurses. You can interact with me and get to know what you actually need. You don't need to pay to ask questions about IVF. You can walk in any day. I want to ask about this. We'll get a nurse to take you through and all that. Get to know what you exactly need. Don't compare, oh, somebody went here, is this amount? Somebody went here, is this amount? Come yourself. Come and listen. Come and see how we can help you. And I'm sure you'll be very happy.
Thank you very much, Doc. It has been very insightful. And that's been Dr. Joseph Homiah. He is the medical director here at Accra Fertility Center. He's also a fertility specialist. So as I said earlier, in case you decide, even if you want to inquire more, he's always available with his team to help you. And this has been Health with Patricia, where we bring medical expert closer to your doorstep. So please stay informed, stay healthy, and see you in the next episode.